estimated excess weight loss for gastric banding, which is the lap band, is about 40 to 50% over 2 years. Now that means 45 to 50% of your total body weight, or also known as your BMI. Well, not known as your BMI. This would also include your BMI, which is body mass index. Sleeve gastrectomy. Again, I have no idea if I'm saying that right. If you remember from the pictures I showed you, this is where they remove an entire portion of your stomach. This is the non-reversible one. It's up to 80% over 12 months. That is really high. The sleeve gastrectomy is the highest, and it is the newest. This one is a recent surgery. It's only been around for maybe 10 years now. They've recently perfected it. They know what they're doing now, as before they were kind of like, we're not 100% sure if this even works. But as I said before, it's irreversible, and there's more risks. So it is kind of risky. My doctor did not advise the sleeving. She has been a metabolic bariatric doctor for a long time, and I trust her judgment. If she says this isn't the route for me, then this isn't the route for me. Now the Roux-en-Y gastric bypass is what I am having done. There's a 65 to 80% over 12 months. So a little bit lower, but around the same numbers as the sleeve. It's safer, and it's reversible if something should happen, or I get really sick, or if I just want to reverse it. These are common, or at least they tell you how common these procedures are. The Roux-en-Y is the most common performed in the U.S., and the second most common is gastric banding. I say in the U.S., but the numbers here say Michigan, so I should probably stick with in Michigan. And then the sleeve is expected to surpass gastric banding in the next couple of years. All of them are covered by most insurances. The concern for vitamin and mineral deficiency is as follows. For gastric banding, it's limited because they're not cutting or removing or changing anything. The sleeve gastrectomy, again, it's limited because they're only removing your stomach. They're not messing with your intestines. They're not changing your absorption process in any way, shape, or form. But with the Roux-en-Y, yes, there is a lifelong need for daily vitamin and mineral supplements, as I've said before. All of them have an increased risk for ulceration and bleeding with NSAIDs. With the Roux-en-Y, there is a syndrome known as dumping syndrome. This is caused by eating fats and sugars and high sodium products. I would say Google it, because I don't want to talk about it. It's not something you want to talk about in a video. It's just, you can Google it. Then Ghrelin, which is the hunger hormone, which I talked about last time. Gastric banding actually has a increased level of Ghrelin. This is not a positive thing. It's, according to the doctors, it's one of the reasons why gastric banding fails so often. And then with gastrectomy, it's decreased. For the Roux-en-Y, it's only decreased for the first 18 to 24 months. After that, I'm not sure I don't remember exactly what takes place then, like if it starts producing again, or I'm not quite sure. I'll have to get more information on that. The average length of surgery time, which means how long I'm going to be in the operating room. Gastric banding is only 30 to 60 minutes. Sleeve is an hour to an hour and a half. And Roux-en-Y is obviously the longest. It's an hour and a half to 2 hours. The average length of time in the hospital, gastric banding has a outpatient program. And then for sleeve and Roux-en-Y, it's 2 days. 5, depending on how long, or depending on any complications or follow-ups that they need to do. Alcohol use after surgery, within moderation for all of them, but with Roux-en-Y, it says to be aware of rapid intoxication and potential liver damage. Basically, right now, I could drink a beer and not feel tipsy. After the surgery, I could take a sip of a beer and be knocked out on my ass for an hour. The alcohol absorption process is 10 times what it was, or what it is now, after surgery. So, this is a big deal for them. They actually have a problem with a lot of people who have bariatric surgery becoming alcoholics, because food is an expression. They eat to feel better. When you don't have food, you turn to other things like smoking or drinking. And drinking is the most rewarding because you can drink less and get intoxicated faster. So, because of this, they actually do have an increased number of patients who have gone through the bariatric program who are alcoholics. So they warn everyone, be careful with this. Pregnancy after surgery. They all say that you shouldn't do it for at least 2 years. I'm not going to have kids anytime soon. Maybe never. So no, I wasn't 100% worried about that one, but I figured I should give you guys those numbers. I realize I'm already 20 minutes in, so this might be a 30-minute video, and I apologize so much. I'm just trying to give you guys as much information as I have. Just a couple of little factoids. I'm not going to read this whole page. I'm only going to read the, it's YGB, or RYGB, which is Roux-en-Y gastric bypass. Just some little factoids about the advantages, disadvantages, and specific surgery risks. The advantages are most common surgery performed, so they know what they're doing. They've perfected their craft. Decreased need for oral diabetic medication in a majority of patients within weeks to months of surgery. I talked to the doctor about this, and the 2 doctors that performed the surgery have both agreed that patients have gone in on numerous medications, including diabetic and high cholesterol and heart disease medications, and have walked out after 3 days in the hospital not needing any of those. So this tells you that this is a life-changing procedure. Some disadvantages are dumping syndrome. Occurs when foods too high in fat or sugar move rapidly through the intestines, causing diarrhea, nausea, cramping, dizziness, and vomiting. Again, I'm sorry I had to read that. I hate it. Some possible surgery risks are leaks anywhere the stomach and small intestine are divided or reconnected. Increased risk for vitamin and mineral deficiencies, especially calcium, iron, and folic acid. And then increased risk for anemia, osteoporosis, or metabolic bone disease. So those are just some risks. And the last piece of paper I have here is just like the benefits of weight loss before bariatric surgery. This is why they put you on diets and exercise programs before surgery. This just talks about why it's good. It helps to set your body in motion to start your body into the phase it needs to be in. It'll boost your metabolism. It'll get your body in the right frame of mind. I'm sorry if I just threw that in front of the camera. This just talks about the frequency and the intensity. You should be exercising 3 to 5 days a week, and to exercise within your target heart rate for about 20 minutes. For about 20 to 60 minutes. I can only go for about 15 or 20 minutes before I have to stop. This is because I am severely out of shape. I have no strength in my body whatsoever. And so this is just one of the things that I have to work on. And then some exercises that are good, especially for people who are overweight, is cycling, swimming, walking, and aerobics. Jogging is on here too, but doctors encourage patients that are overweight to avoid jogging. Actually, a lot of doctors encourage a lot of patients to stay away from jogging because it jars your knees and can cause knee problems in the future. So that's just some, tips that everybody should have. I figured I would share some of those. So that's pretty much it for today. Looks like I'm going to be under a half hour today. So I hope you guys enjoyed the video. I will be on the 11th to let you guys know exactly what happened and whether or not I got a green light or yellow light or even a red light. Oh, I hope I don't get a red light. I really hope I don't get a red light. But anyway, I'll talk to you guys later. Go out, enjoy the weather, spend some time with your family, and if you guys have any questions or concerns, please comment. This is the time to really ask all the questions that you need to ask, or to just check in with me. I'm always willing to answer any questions that you guys have. Love you guys.